Is it Jamie Lewis's mum?
Yes, I'm Angie.
Hi, Angie. Nice to meet you. I'm Raphael. I'm one of the doctors on the ward. I understand you've come today to speak about your son. Is that right?
Yeah, I have. I'm actually quite upset because...
I'm sorry to hear that. What's going on?
Yeah, so I came onto the ward because I was waiting to talk to you about my son, and I heard the nursing staff refer to Jamie as a schizophrenic, and I just think that's completely unacceptable because no one's talked to me about what's going on. They've just given him some label that I've never heard of before, and it's wrong because that's not what he has. So I just want to have a chat with you to find out what's happening because it's just not, it's not on.
Well, I'm really sorry that happened, and that's exactly what we can have a chat today about, what's gone on with Jamie. The first thing that might be good is for you to tell me a little bit about, from your perspective, what's happened with Jamie. How have we got here today with him being in?
I mean, all I know is that he was going to university, he was fine, he was, in his first year doing computer science, and the next thing I know, I'm getting calls, saying that he's not coming to, his exams and stuff, and they're worried about him, and he then came home and then just stayed in his room all day and, wouldn't really go out, and so that's why I brought him to hospital.
So that must be really hard for you as a mum, seeing your child struggle and be unwell, and I just want to recognise how difficult that must be.
Yeah.
And I think it's a really good time for us to touch base and talk a bit about what is going on with Jamie.
Okay, thanks. Yeah, that'd be helpful.
So I think the first thing to say is our understanding of what's happening with Jamie at the moment is he's having something called a psychotic episode. Is that something you've heard of, the term kind of psychosis?
Yeah, but why do you think Jamie has that?
Yeah, so I guess when we think about psychosis, what we think about are these symptoms of kind of losing touch with reality, and that might be sort of hearing things that aren't there. It might be sort of seeing or experiencing things that aren't there. Okay. It's sometimes struggling to arrange your thoughts in order, and sometimes it's kind of believing things without any kind of basis in reality, and believe them so strongly you can't be convinced otherwise. That's something we call kind of like delusions. And with Jamie, what we've seen when he's been with us is, I think he's been hearing voices, and in it that aren't real, but feel to him like they are real.
Yeah.
And that's contributed to this sense of people being after him and him being unsafe, and he's started to develop these beliefs that he's not safe and that others are after him.
Okay.
Yeah, which it sounds like wouldn't be normal for Jamie before this at all.
No, not at all. No, he was. But why do they say he's got schizophrenia? Like, what's the difference?
Yeah, and I don't know why they said that. Often there's this confusion between schizophrenia and psychosis. And I think the thing to say is this is the first time Jamie's ever had psychosis. There's lots of different things that it could be. There's different things that cause psychosis.
Okay.
So one of them is schizophrenia. Is that something, do you know much about schizophrenia?
No, I just thought, you see it in the news and it's like people, who murder people and, they all do drugs and, criminal activity. That's what I thought it was.
Yes, there's a lot of stigma around schizophrenia, but what schizophrenia is it's an illness.
Okay.
It's a chronic illness. So it's an illness where you have episodes of psychosis that are recurrent. So you don't just have one, you often have multiple. And along with those episodes of psychosis, you often get something called the negative symptoms, and that's a bit like what you first described with Jamie can happen in terms of withdrawing, kind of not feeling like not engaging with society, losing your motivation and ability to want to do things, feeling quite flat in mood.
Yeah.
So
why does he have it?
So I think the first thing to say is we don't know that he does have schizophrenia. Okay. So this is the first time Jamie's presented with psychosis. There's a range of different things that could cause it. We know that if someone comes in with psychosis, within 3 years, 50% of people won't have another episode.
Okay.
So it's not inevitable that Jamie will have another episode and get schizophrenia. In addition, other conditions can cause psychosis. So we know people who have very severe depression, bipolar, those can also result in psychosis. Schizophrenia is just one condition that causes psychosis.
Okay, so he can recover, he can get better from this.
Even if he had paranoid schizophrenia, it's not saying that he can't recover or can't get better. So we're not even at the diagnosis, but even after the diagnosis, there's a number of people who do really well with schizophrenia.
Yeah. What's the treatment?
So with treatments, we always think about hitting it from every angle. So people who have a first episode of psychosis, the important thing is to get them into a specialist service once they're ready to go home from hospital that has expertise in treating psychosis. So there's an early intervention team that we'd refer Jamie to in the community, and they have access to psychology to help support him with psychology and therapies that might be useful for him. They have occupational therapists who work with him about, talked about him being at university, how he goes back to university, how he manages his workload, how he reduces his stress. And then we also think about medication. So for psychosis, the primary medications we use are antipsychotic medications. And that's what we've started Jamie on in hospital. And normally it's really important we continue them for at least a little bit after they get out of hospital. So we want to hit it from kind of every angle.
Yeah, okay. And why does he have it? Is it something that I did, or like why has it got this?
No, it's not something you did. We know a bit about what contributes to psychosis. We don't know exactly what causes it, but we know that there's a number of different things. So, I mean, one is sometimes there's a genetic cause. Do you have any family history of severe mental illness?
I mean, I don't know much about his dad's side because we, separated, but I think maybe they've got something like that in their side, yeah, so maybe.
I mean, the other thing is, I know you mentioned drugs. Sometimes people using drugs can make them more likely to develop psychosis. Do you know if that ever was a problem for Jamie?
Yeah, I heard he was smoking weed at uni. Yeah.
So we know that's a really big risk factor for psychosis. And actually, that means that for Jamie, one of the most important things that's going to be for us to do is do a bit of education around that, about actually how risky it is to smoke cannabis when you can get these symptoms, and helping support him staying away from cannabis. That's going to be a really important part of our treatment. Do you have any other questions about that?
No, actually, you've been really helpful, and I feel a lot better after talking to you, and thank you for explaining. Sorry for being upset earlier.
We're allowed to be upset, so it's a sad situation, and I think it's really important that he's in the right place and we're getting him the treatment that he needs.
Thank you, Doctor.
Okay, thank you very much.